All right, welcome back to HBD Comes Alive.
Nice. I like it.
Let us know what you think.
You need to make it 3D.
I know, right? So, today we're going to discuss implants.
Yeah.
It's a big topic everyone asks questions about. It's one of those things where people don't know exactly what it is, but a lot of times they are told they need an implant. So we want to go over some what that means.
Yeah, so first of all, what is an implant? Well, an implant, I've got one in my hand here. It's a piece of titanium, and it's used to replace missing teeth. Sometimes you're replacing all of the teeth, sometimes you're replacing a single tooth. The material is very friendly, and your bone will actually fuse to that titanium. So it's quite the revolutionary piece of technology and has helped millions of people chew, function, talk, smile normally again. So
now we'll go spend the next 30 minutes talking about the biochemistry
Yeah.
behind how the bone and the titanium really conform together.
yes, please, Dr. Hills,
Yes.
expound.
Yes, so not really. But with the implant, people always wonder, well, how long does that take?
Yeah.
And so really a lot of the time comes in preparation. So you don't just go in there and put that in. You want to be able to look at everything. So we take a 3D x-ray, which is going to give us different dimensions of the bones where we can see where's the best placement, where's the most success rate for that implant. So a successful implant is where there's lots of bone.
And, patients will ask grafting. They've heard grafting. Oh, I'm going to need some grafting for this procedure. So not every implant surgery will need grafting, but that 3D x-ray helps so much in assessing for your implant success what it will need as far as if any extra grafting is going to be needed, what kind of grafting procedure, because there's different ones as far as aesthetics are concerned. How's that going to be handled? There's different types of grafting out there, and so feel free to ask away and inform yourself on what is needed or is happening there. But not every case will need it. Some cases do. And usually if it does need it, there's good reason for having that.
Well, and almost I would say every time you get an extraction, if you're going to want an implant, you're going to want to put some bone graft in.
For sure. Yeah, because the implant, you can see how small it is here, is typically going to be a lot smaller than the original root that was there for the extraction. But that reminds me, an extraction can be a painful process. There's going to be some soreness because it can be quite a traumatic thing for the bone and the tissue to go through. Talk to us about pain in implants, Dr. Hills.
Yeah, so everyone's worried about, hey, after my implant, is it going to be painful? And the implant itself won't be painful, right? When it goes into the bone, there's no nerve in the implant, right? It's just titanium. So you're not going to feel the pain there, but you will have some swelling, some pain from the tissue because we're either having to cut the tissue, retract it a little bit, and a lot of times we'll put some stitches in to close that up. And so you will have some healing process with the tissue, and that's mostly where the pain comes from. If there's infection or things like that, then that may cause some pain. Right. But that's a bigger issue than just if everything's healing well, you're not going to have a lot of pain post-op from having an implant placed.
Yeah, the majority of my complicated cases that I see for patients that need, root canals, extraction, implant, crowns, fillings, and all that stuff, typically by the time we're getting to the implant stage, they'll find that while that was something they were very scared to go through, that it was probably the easiest part of that whole process. And so fear of pain is very prevalent because it sounds really scary, but the good news is, and the fun part about it is, it's surprisingly very easy on the patient to have done.
And the other good thing is you can't get a cavity with an implant.
Yeah.
Right? So that's positive, but it does not mean that you don't have to brush it.
That's true.
So
yes,
you do want to take care of the implants because they can still fail and so it actually doing brushing and flossing is very important because of that bone level.
Right.
Right. If you don't take care of it, you're going to start losing that bone, which is what's the most important part of that implant. That's really what's holding it together.
Yeah.
So you want to treat it like a normal tooth. Brush it, floss it, getting food out that's in there, and also try not to like grind on it. Now you can chew. It's not like it's going to break. It's going to hold up like any other tooth.
Yeah.
They're very sturdy. They're going to last you, 20, 30 years if you're taking good care of that tooth, or that implant. So they have great results and they have great success rate as well.
Yeah, really, a lot of the success of the implant is determined by you, the patient. And so, as a doctor, we can see a patient's health level comparison by performing these types of procedures on them. I remember we had a former Olympian come in. We placed a few implants in her mouth, and I just remember how excited I was because she was in such good health that it made me look really good because everything was just so smooth and did so well. So the better you take care of yourself, the longer those implants are going to last, and the better the outcome you're going to have. So good habits are important. Having the dentist show you how to floss around an implant is important because it's a little bit different than a natural tooth tube. So we're here to help and happy to do so. If you have any other questions or anything else you want to know about dental implants, please leave a comment below. Thanks so much.
Thanks.